So I'm here today with Dr Daniel Mandziak from OrthopaedicSA SA, and today we're going to talk about hip replacements, and in particular the anterior approach to hip replacements. So thanks for making the time to spend time with me today, Daniel. Can you tell us a little bit about you and your practice, just to begin with?
Yeah, sure, Tim. I'm an orthopaedic surgeon, and I have a special interest in hip and knee replacement, including redos or revisions. Yep. I also do sports injuries and trauma surgery. And I would say out of all those things that my main interest lies around direct anterior hip replacement and also computer-aided surgery.
Okay, great. So why don't you tell us about direct anterior hip replacement as opposed to what is traditionally done, I suppose, in Australia, which is the sort of posterior lateral approach. What's different about it?
Yeah, so I mean, the first thing to recognise, I suppose, there are three main approaches used for the hip.
Yep.
And an excellent result can be obtained by any of these approaches, as we've seen over the last 50 years or so. So traditionally the main approaches used have been a lateral approach, which has an incision based over the side of the hip, and as part of the approach you detach part of a gluteus medius tendon, and that's then reinserted or repaired at the end of the procedure.
Yep. The
posterior approach has a laterally or side-based incision as well, but curves around into the buttock and approaches the back of the hip joint. And that involves splitting gluteus maximus muscle along the line of its fibres, and also detaching the short external rotator muscles and tendons from the back of the hip joint, and then these are repaired at the end of the procedure as well. So the direct anterior approach is based over the front of the hip, and I suppose it's slightly different in that it goes between muscle groups, and it's the only approach that I suppose doesn't really detach any muscles or tendons from the bone as part of the approach.
Yep. Okay, it's got to be an advantage. So my next question was, what are the advantages of this approach, I suppose, as opposed to some of the more traditional approaches we do see? Is there a patient population with an arthritic hip that is more suited to an anterior approach?
Yeah, sure. The main advantages that I've seen in my patients with the direct anterior approach are that they are more comfortable and they appear to use less painkillers and for a shorter period of time. And the other main advantage is that in the first 6 weeks in particular, they rehabilitate a bit quicker. So they, for example, will get rid of their walking aids a little sooner than other approaches. And in terms of the patients who specifically are suited to this approach, I would say that it does suit the average patient with osteoarthritis or rheumatoid arthritis of their hip. It's probably more suited to the slimmer patients, because I think if someone has a large belly or if they have a big fold of skin, with the incision being placed over the front of the hip, if there's a fold of skin or a moist crease, which when they're rehabilitating creates a moist environment over the wound, or this skin overlying it, I think it's probably not suited to that patient due to risk of wound healing problems or infection. So in those patients I'll generally direct them to one of the other approaches and offer them that one instead. So generally as a rule I would say the slightly slimmer patients, maybe the body mass index less than 35, might be better suited to it.